Hello, my name is Carolyn Stern, and I manage outreach programs at the Center for Hearing and Communication, otherwise known as CHC, based in New York City and Florida. Our long-standing organization, we're over 111 years old, focuses on hearing rehabilitative care with over 20,000 visits a year. Through my professional work at CHC, and as a person with a progressive loss who now uses 2 cochlear implants, I have witnessed firsthand the importance of good hearing health. Communication, which CHC makes possible through their services, is so vital to help people like myself connect with loved ones, friends, co-workers, and community, especially during this time. At CHC, we feel strongly that even in a pandemic, taking care of our hearing is paramount. We're excited to have here today with us 2 audiologists from CHC, Dr. Ellen Lafargue and Dr. Anita Stein-Meyers, who are the director and assistant director of the Shelley and Stephen Einhorn Audiology Center, respectively. Dr. Lafargue and Dr. Stein-Meyers have been at the forefront daily for well over a year now. Let's hear from these two experts about the hardships they've seen their clients experience during this time, and learn from them and hear from them what's working and how they're guiding their clients. So let's start with the first question. Dr. Lafargue, can you share with us some of the challenges that adults are experiencing during this time? And Dr. Stein-Meyers, please chime in as well about children.
So some of the challenges are exactly what you would expect them to be. And the first things we think of are face masks and social distancing. For as long as we've been advising people on best communication, we've been telling them to look directly at people's faces to help get speech reading or lip reading clues. And we've been telling them to be up close and personal so that they can see and hear as well as possible. Well, with the pandemic, we are all wearing face masks, and that not only obliterates the visual cues in most cases, but it also muffles the sound. And there have been studies that show that the sound muffling is significant. It can be as much as 10 decibels, depending on the kind of mask, which is a lot of sound. The distance, keeping 6 feet away, also dissipates the sound and makes it harder to see. So we can't do anything to eliminate that. So we've come up with some strategies such as clear masks or using other visuals like captioning and writing pieces of paper down so that we can get the information in without using necessarily our ears. Another thing that's not quite as obvious is that people are not coming in for routine care because they're concerned about the safety of being close to someone in a medical appointment. And this is not just in hearing healthcare, but in healthcare overall. And we all have to weigh risks and benefits, and communication is vital, so it is important to keep on top of your hearing healthcare. And a third big issue that we're seeing is people losing hearing aids. There's just an enormous uptick in the amount of hearing aids being lost because you go to take your face mask off and there goes your hearing aids flying. And especially if you are in some sort of a stressful situation, you may not think about the hearing aid right away. So we really have to, be aware of ourselves and in our space so that we can focus on the communication and on the hearing. Anita, what do you think about that's different with kids?
Well, I think all of the points that you made are very valid, and they most definitely apply to children. I think losing hearing aids has definitely been on the rise with children. Children are more active than adults and sometimes not as aware of their own personal being. So wearing a mask, wearing glasses, wearing hearing aids, wearing all three usually equals something's going to get lost at one point in time. And we've been encouraging families of children, and this can apply for adults as well, to use some mechanism to secure the hearing aids to their body or clothing. There's a number of commercially available devices and a lot of made-at-home devices that can connect from the hearing aid to an article of clothing or a headband or a hair clip. These retention devices are definitely a good recommendation to reduce the chances of hearing devices getting lost. But I think one thing that is an added impact of mask wearing and social distancing is how children are functioning in a classroom situation. The truth is some children have not returned to in-person learning. There are a lot of older children in many cities who are only able to learn remotely because of school guidelines. And there's a number of parents of younger children who have chosen to have remote learning. So for those families who have the technology for their children to participate in remote learning, we have an added challenge of how they're going to hear with the technology at home. If you have multiple children at home, now you have many children listening with laptops or headphones or tablets, and sometimes the way that you hear can be altered through another source, such as a laptop or a tablet. So we're working with families as well as school district staff to ensure that the students have added technology at home that can allow them to connect their hearing aids or cochlear implants to their laptops and tablets and stream or listen directly into their hearing devices. For the children who are in school and not participating in remote learning, the challenge of mask wearing and the challenge of being socially distant is another factor. It adds fatigue and stress for the children. It makes the teachers need to implement additional resources such as clear masks or plexiglass dividers between students and children. And all of these things impact on the quality of sound. For children who communicate with sign language, they have the benefit of being able to access information visually, but for children who are auditory oral learners, the quality of sound and the way that they hear has really been impacted. And it's been such a stressful time for all the families.
Another thing I'd just like to add in is we rarely think about people with really mild hearing losses being affected, but with mild losses, the sound that's being muffled from the masks are having an impact on the one hand. On the other hand, those people with mild losses who were before the pandemic having a lot of problems in noisy restaurants and group conversations aren't facing those challenges because they're not going to restaurants and they're not in groups. So I think we're going to be seeing as things open up again, that there's this group that thought, I didn't really have a problem with this. Uh-oh, here we go again, and it's going to come back. So I think it's something that we're going to have to be aware of going forward.
Very much so. And I think for some children as well, and this may apply to adults, there's a population of individuals with more milder degrees of hearing loss who may not have worn hearing aids consistently, and now they're finding that they're needing to wear their hearing aids on a regular basis. And for sure, that's a good thing. They're hearing better, their brain is getting that needed input, but it's increasing the need for visits, and they need to know that they can come in on a regular basis for testing and hearing aid adjustments, and not to overlook their hearing care as a part of their overall medical care.
Anita, and Ellen, I would really like to hear a little bit about, from a technology perspective, what are some of the things that, as an audiologist, can you offer your clients? What are some things that are working?
Well, one of the things with my adult clients that we have found is that most hearing aids now have multiple programs in them, or they have the capability of having multiple programs. What that means is it's sort of like changing the channel. If you don't like what you see on channel 2, you turn to channel 4. Well, with the hearing aid, if you don't like the way it sounds on program 1, you can change it to program 2. And we are programming an extra program in many cases so that there's a little bit extra volume or a little bit extra higher pitch, perhaps, that's not coming through all the masks. And not that people should be using those all the time, but in those specific communication situations, we have found that that is quite helpful. Also, there are accessories that can be purchased in addition to a lot of hearing aids. So there are such a thing as what are called remote microphones, or you can learn how to use your cell phone as an extra microphone. And what that does is, if you hand the speaker a microphone, or if you point it out towards them, it brings the voice more directly into the hearing aids, and that can be very helpful for people. Also, we have told a lot of people about speech-to-text captioning that's available on a lot of smartphones, either through an extra app or just by opening a notes section. And many people did not know that this existed. They're not familiar with them, and people find it to be very helpful. And then there's, the old fallback of a piece of paper and a pen. And I have one client who always says there's nothing as good as the old school. You just take out your paper and pen and you can write down what works.
Yeah, that is really good advice, to not leave home without a pad and paper these days. And it's really good that you have some things to offer that are tangible. And Anita, what about children? Are these the same solutions? Are there some things that are different, and are they all tech-based, or are there other non-tech-based solutions that you're encouraging them to use?
Well, I think some of the solutions are similar, that while a very young child may not have multiple programs on their hearing aids or their cochlear implants, there's surely programming changes that can be made to their hearing devices to help improve how they're hearing if masks are going to be worn during communication and learning time. I think the added bonus of older children being able to read and write is that they can make use of cell phone technology and captioning apps. Their school assistive listening devices can be used at home and can be used in the classroom, so that teachers can wear a microphone, a parent can wear a microphone. These microphones can be plugged into their computers and tablets or in-school smart boards so that they're hearing with greater ease. So I think technology has really evolved, and there's almost always a technology solution to help improve how a child is communicating in those situations. And I think it's very specific to the individual, what technology they have, what technology they're able to use. But I do think that there's a lot of this that applies to the pediatric population as well as the adult population.
And what about like non-tech solutions? Technology may not solve every situation. Batteries die, or they forget to recharge, or you're just in a situation where it's noisier. What are you recommending? Any other tips or strategies?
Well, I think adults on some hand are already better advocates for themselves than a child may be. So I think parents can work with their children. Teachers and therapists can work with their children to teach them advocacy skills, to really say, I know you have to wear a mask, but it's harder for me to hear you when you have a mask on. So can you please speak a little bit more slowly? Can you please, point or write some things down for me if a child is old enough to read? I think for the oral communicators, those simple solutions can really help teach other people what is needed for you to more effectively listen. I think for individuals who communicate with American Sign Language, I think so much of how you communicate is facial expression and sometimes body language. The body language can be enhanced when you can't have access to facial expressions for lip reading cues also. So I think that there are solutions, and that person or their family member can work towards, advocacy to get them the information or the way to communicate a little bit, more easily.
Yeah, that's good. And Ellen, for adults, are you finding that this is a little new for adults to have to advocate for themselves in this way? Do you think that this is more challenging for them, or
Without question, it is more challenging. There are some people who have been advocates for a long time, belong to various organizations that encourage that, and then there are other people who are new to the world of having hearing loss and communication challenges, or even people who have had hearing loss for a long time, but perhaps have not acknowledged it or have been able to, get by without, needing to be quite so verbal and address the issues more than just putting a hearing aid on, but by saying what you need from the other person in order to communicate. And I think, that's probably the best advice that I could give is share what it is that you need. Tell them, tell people, what you're saying is of value to me, and I need to be able to have you do X, Y, and Z in order for me to understand you. And I think that, when you do that, you make people realize that, the communication is important, and most people are going to be willing to help you out.
Yeah.
If I could also add one thing.
Sure.
I think people just have to be kind to themselves. Communicating can be stressful on its own. Communicating when you have to stay apart, communicating when you can't see somebody's face, communicating through technology, it adds a stress factor and a fatigue factor. So people need to give themselves, a moment to have a break, a moment to have a disconnect from everything so that you can regroup. So you have to take care of your whole self, and that sometimes then results in easier communicating and stress reduction.
Yeah, Anita, I think that's really good advice. I try to remind myself to do that and not overschedule, really give myself breaks. So thank you so much for joining us today, Ellen and Anita. We really appreciate you sharing what you're hearing and experiencing from your clients during this time, and all of the different solutions that are available to make it a little bit easier, from technology to simple communication strategies, and most important, advocating and being kind to ourselves and resting in between, to give ourselves a chance to get ready for that next communication encounter. So we just thank you so much. We hope that our listeners can take some of these suggestions back to your community, share with your friends, and we hope that you can apply some of this to make this time a little easier.